Welcome to Chapter 12 for Exercise Programming for Special Populations. We'll be talking about older adults in this one. All right, so the muscular system, skeletal muscle plays a role in movement, independent weight maintenance, and overall health. After 30 years old, muscle mass declines without exercise, leading to major implications for health and quality of life. Again, this is why a lot of times when you guys go to your 20-year reunion, people start to look real different. Those that haven't stayed active, you'll notice some major declines in muscle they used to have. You'll also notice most of them put on a lot of weight that they don't need as well. For people who do not perform resistance training, muscle tissue is lost at a rate of about 3 to 8% each decade, decreasing by 5 to 10% each decade after the age of 50 and declining more rapidly after the age of 60. This decline in muscle with age is called sarcopenia. All right. So again, it's another form of muscle atrophy. But muscle atrophy can, typical muscle atrophy is just, if you're working all the time, you stop, you're going to see some decline, right? That's normal. That's muscle atrophy. But when it's age related, they give it a whole other term. So again, if you ever see that on a test, what's the difference between sarcopenia and muscle atrophy? Sarcopenia is basically muscle atrophy just due to age itself, right? Because muscle mass is so metabolically active, muscle loss results in decline in metabolic rate, leading directly to an increase in body weight and contributing to metabolic disease. So again, your muscle mass has metabolic properties, okay? And again, even there's a really interesting study that I've read several months ago. Even fat mass in that has some metabolic activity. A lot of, for years and years and years, we didn't really think it did. But just sheer mass itself does. And it's amazing when you're extremely overweight. You actually, a lot of times people think, oh, I'm extremely overweight and my metabolism is shot. And the only reason your metabolism would be shot at that point is if you've done enough damage to, some of your hormone producing organs and so on and so forth. But that's kind of off the point. But anyways, if you're relatively heavy but extremely overweight, it's not the truth. Actually, your body burns a bit more quickly, even with non-muscle mass. Now, again, muscle mass has a faster metabolic rate than fat mass. So again, this will have a better pound for pound, better metabolic rate, but your body actually wants to get that excess weight off. I mean, and that's one of those physiological phenomenon that's really interesting, is that even when you have a lot of excess fat, it does increase your metabolism. It's almost like your body's telling you like, hey, this isn't good for us. Let's get rid of it. Okay. So when you hear this, some people think that it's only muscle mass that has metabolic properties, or a higher metabolic, or has metabolic activity, which isn't true. It just has a higher metabolic activity than like your fat mass and so on and so forth, right? But again, not working out, not overeating and all that will contribute to metabolic diseases. In particular, increase in intra-abdominal fat are related to metabolic and cardiovascular disease, since muscle tissue is largely responsible for glucose metabolism and triglyceride disposal. Sarcopenia is also related to osteopenia, or an age-related loss of bone tissue affecting the 35 million American adults, more women than men. So again, girls, be aware of that and understand the importance that weight training plays for you, not only in muscle mass, but bone mass. Muscle mass may decrease as much as 10% each decade. Bone mass may decrease as much as 30% each decade, ranging from 1 to 3% reduction in bone mineral density each year. Type 2 muscle fibers, which are your fast twitch, are lost at a greater rate than type 1, which are slow twitch muscle fibers, resulting in loss of muscle power that declines at a faster rate than muscle strength with age. Muscle endurance, which is more closely associated with type 1 muscle fibers than type 2, decreases at a slower rate, which would make sense based on what we saw in the upper part of this slide. Age also affects cardiorespiratory system. Maximal stroke volume, heart rate, and cardiac output decrease progressively throughout the aging process. Increases in ventricular wall thickness and stiffness of arterial walls and lung tissue further contribute to overall decline in aerobic capacity. And again, all this works at a much faster rate when you don't use it. Your body has this lose it or use it principle. It's kind of a simplistic term to say, and it's not that it works exactly that perfect. But when you look at the physiological decline that happens in your body when you're not using things, and again, you can look at all the different pathologies, but that's the overall effect that does happen. So understand that dyslipidemia and hypertension are also much more common in older individuals, but exercise intervention can have positive effects on these adverse changes. People always ask me what's more important, diet or exercise, and it's a bad question. It's a loaded question. And again, we're going to talk here in a minute about exercise. We don't talk much about diet in this particular book. It's not really the main focus. But if you're going to say it has to be one or the other, you will see better health effects with, so if you take say an average diet, if you were going to look at an average diet, and or which is typical American diet, we're not going to look at like the deep end of eating really healthy or the deep end of eating like just like, and I hate using the term junk food or something like that, but yeah, again, it's a poor term because all food has its benefits. All food in excess can have its issues, but if you have a typical American diet, and you're just gaining a little bit here and there because you're sedentary, you'd be you're going to find more research that's going to show that exercise has better health effects on its own versus diet on its own. It's got more protective benefits. There's a lot more physiological benefits that we see. Again, you always hear, oh yeah, you can't out exercise your diet. Well, it depends on how much you're eating, to be honest. Like if you're only eating a little bit in excess and you're not gaining a lot, really, you typically could out exercise your diet. Now, that being said, like I said, it's a bad question because if you're looking for being in the best health, there are certain things that you may be missing in your diet, especially important nutrients for your overall health. And so the combination of exercise and a healthier diet than what you make currently, and what I mean by healthier, don't get me wrong, because I get irritated with all the people are like, okay, you can't eat this, you can't eat that. Is basically a healthier diet means that, if you look at a typical American diet, not a lot of fruits and vegetables and things that have good nutrients are added into the diet. So you're actually adding more of that in, and the things that are more caloric dense and don't have a lot of nutrient or nutritional value in that sense from very little nutrients. If you'll just eat either that less often or less amounts or some combination of the two, you can eat whatever you want. You can get more healthy foods in there, and your health will be amazing, and you don't have to give anything up. That's the one thing I always try to tell people is, because I get irritated with folks in my industry that have no clue about how nutrition works. They have no clue about how exercise works. And then on top of that, they really don't understand, because there's some folks that just, they've been, they've just always been like really strict on eating, or maybe they just have an affinity for fruits and vegetables and sweets don't really appeal as much to them or something like that. And again, I'm one of those, I'm not a big sweets person. So, but I understand the desire for sweets, and I understand that, some people just can't not eat sweets. And that's the thing, is you don't have to go that route. Um, so again, just trying to give you guys a little bit of extra knowledge in this, especially as practitioners, because I don't want you to be one of those, oh, you can do this, you can't do that. No, you can exercise, you can eat healthier, and you can also enjoy your life at the same time, right? Um, Brain and nervous system. Poor physical effects of aging on the nervous system, poor physical self-concept, general mood disturbances, depression, high tension, anxiety, and reduced cognitive abilities, decline in motor skills and performance of physical tasks, less accurate visual information from eye-limb coordination, hearing loss, desensitization of muscle sensory systems such as the Golgi tendon, organ, and muscle spindles, which those are the ones that tell your body to relax when you're too tense so that you don't tear something, and then vice versa, tell your muscles to tense up when they're being stretched too far to keep from, again, tearing. Although it's impossible to list a variety of medications used by older adults, there are several important considerations for exercise professionals. 87% of those aged 62 through 85 years take at least one prescription med, and often more than one physician is prescribing the medications. And again, there's potential harmful drug interactions, which must be a consideration for all healthcare professionals. Again, with the globalization of our health information, I know some people get scared by this, like, oh, my health information's out there on the web. But with it being able to be accessed from doctor to doctor, huge. Because again, you got to think about back in the day when you go see one doc and that information may not be privy to another doc. They could be giving you one medication for one issue, another medication for the other, and it can become a deadly cocktail that could cause you other problems, right? Medications that slow the heart rate are common, and physicians' recommendation for training intensity may be necessary. Again, I told you guys I'm not a big heart rate type of person when it comes to things, because you just don't know the inner workings that's going on in people. And again, um, not only if they're healthy or not healthy, or if they're on meds or not on meds, their training status can affect whether or not they're in a certain range. And again, you can have somebody that's in like at a certain age, but they're highly trained. Their heart rate can actually go a lot higher doing the same type of work as somebody else that can't. And so all that needs to just be taken into consideration. And again, working out a way, like I said, I know the talk test is not really, it's one of those things that you can't really quantify well, but in practical use, and if you're good at reading people, it works. I honestly love that test. It works really well. I mean, I guess somebody could lie on the test and they could act like they can't talk to get out of doing exercise, but that's one thing if they want to be lazy, I guess. But the nice thing is they can't lie to you and pretend like nothing's wrong when you need to worry about pushing them too much. So that's one thing I do like about it. Older adults should keep a list of their medications to inform decision making by the exercise professionals, including an understanding of potential side effects. Again, they may want to hide that stuff from you. You can't help that, but you may just want to tell them that, a lot of the meds that you may be taking can give you adverse effects when you're pushing your body, and doing exercise. And so we just need to be aware of what you're on, those effects, be aware of feelings and situations. It doesn't mean you can't exercise, but it means that, we may prescribe certain things over others. And there's certain things that if I can be aware to look for, we make sure nothing bad happens to you. Again, some people, we get that child thing, like, Have you had a cookie yet today? And you kind of want to be like, no, because you want another cookie. Some people think, well, I really want to get an exercise or whatever, I need it. And they're worried that what they're on may hinder that. So, just kind of put them at ease that like, no, I'm going to work with you. We're going to get you to your goals, but I got to be 100% aware of everything going on. Right. And you need to review material and other chapters of this text regarding specific conditions, corresponding medications. Again, this is a great text to own. Okay. Don't get rid of this book when you're done with this class. If you're going to work in the field, this is one of those books that you want to take with you. Okay. Aerobic capacity. There's general increase in aerobic capacity in response to aerobic endurance training. Increases in part due to improved pumping capacity of the heart. Other improvements include a lower heart rate and lower resting blood pressure. This is just something, a little side note, but it's just something to consider, especially if you work with people of different ages. So again, a lot of times when you work with younger ages, and you're trying to get them to exercise, or you're trying to like kind of educate them as their life's going to go further as they do already currently exercise, is to remind them that the years that they spend not taking care of themselves, yeah, you can always get back in shape. Yeah, you can always get better health, but the thing is the years you spend not doing stuff, your heart loses capacity to do work. Your arteries lose capacity to expand and contract. Now you can improve that once you start exercising again, but there's no guarantee that you're going to have those things working, or your lungs or anything else. You're not ever going to have them maybe working optimally where they could have been if they would have just continued, if they were always flexing those muscles, so to speak. It's just one of those things that it's an important concept to understand. It's an important concept to get others to understand, to know that, too much time off can cause some lasting damage. And so to keep that in the back of their mind as they, go through lazy periods or things like that. Other improvements include lower heart rate, lower resting blood pressure. Exercise on muscle mass and metabolic rates. Again, there's a lot of research on there that that you don't have to like lift big, but just a little resistance training 2 or 3 days a week can increase muscle mass, even in older adults, by an average of 3 pounds. There's also evidence that resistance training that causes micro trauma requires an increase in metabolic rate by about 5 to 9% and lasts 72 hours after the workout. So again, it increases your muscle mass, and your metabolism's got to increase some as well to now repair damage, again, not major damage, but micro damage that you've done to your body, this is good damage, right? There's good and bad. This is good damage because it's repairable, right? Chronic resistance training also has effect through muscle hypertrophy that occurs after 6 to 8 weeks of training. Again, each additional pound of added muscle requires an additional 9 calories per day for maintenance. Over time, this can result in substantial weight loss. Again, you may be gaining weight, but there's good weight and there's excess weight. I don't want to say bad weight, but good weight, excess weight, because again, you got to keep some body fat percentage on you. So there's a threshold of, you've got a good amount of fat and it's healthy. You've got too much fat and it's not healthy. There's also, like if you look at anorexia and bulimia, if you go the other way, if you don't have enough, that's not healthy as well, right? So again, 5 pounds of additional muscle would result in 45 extra calories a day, theoretically translating into nearly 5 pounds of fat loss over a year. Again, that's not taking in effect calories in, but if all things hold constant, so to speak. So if you were basically, say you gained weight, but you're maintaining at that point, then yeah, right. If all the stars and the moons align, type of thing. Both resistance training aerobic exercise result in substantial acute increases in metabolic rate and contribute to overall weight maintenance or fat loss over time. Again, when you're looking at all this, it seems very simplistic, which It is from a mathematical scientific point. Where it gets difficult is the psychology aspect of it, and the other part is that the individual aspect, when you add the individual into it, we don't know what's going on exactly in every individual body, based on what you have and have not done to yourself for the years, or maybe birth or congenital things that have happened to you. So this is all great theory, but when you put it into practice, you will find it is much more difficult, because some people do have faster metabolisms, even beyond, like just the normal, like, okay, like if you do all these equations and all that, just because of things that they have done or not done, and vice versa. You have people that like to exercise. You have people that hate it. I mean, you know, um, that all makes this muddy water. Okay. Um, Type 2 diabetes, important as aerobic exercise for maintaining body fat, excuse me, and controlling glucose levels. Resistance training may be as effective because of its ability to improve insulin resistance and glycemic control, decrease glycosylated hemoglobin, increase muscle mass, and increase glucose transport type 4 density. Again, type 2 diabetes becomes a much higher risk as you get older, especially in sedentary adults. And again, exercise is a good preventative combat towards that. Resting blood pressure, both aerobic exercise and resistance training are shown to reduce resting blood pressure. And again, there's a weird thing that can occur in those that are really highly trained, where their resting blood pressure may stay somewhat elevated, and again, it has to do with the effect of the super increased cardiac output that they have. So again, sometimes you may see that. Don't be super surprised, but it can happen in really, really highly trained aerobic athletes. But um, resistance training, when performed alone and in conjunction with aerobic exercise, can reduce systolic between 3.2 and 6, or diastolic between 1.4 and 4.7. Aerobic and resistance training show lower total cholesterol, LDL cholesterol levels, lower triglycerides, and higher HDL, which is your good. Resistance and aerobic yields the greatest results. So, if you're like, well, should I do one or the other? If we're going for health, you want both. Right. Health is always both. The only time I tell people that, that you need to lay off one or the other, or do very little of one or the other, is when they are like bodybuilders or athletes, and in too much of one may cause a detriment to their goals in their sport. So that's really the only time I'd say don't do both. Um, so again, general cardio health is also improved, with research showing resistance training on its own can be nearly as effective as aerobic, although a combination of both is recommended. What this means, you're like, well, how do you get better cardio? It's just saying, like, if you're getting an adequate increase of cardio. So if you're just doing resistance training, you'll get to what they'd say, well, you're adequately healthy cardiovascular wise. Again, cardio's, you're going to see much greater improvement where you'll go beyond that. But just getting you to where you need to be, it's as effective. All right. So the way that part's written, I know some people are like, wait, that doesn't make sense. It does if you understand what the statement is they're trying to say. Bone mineral density resistance training has generally been shown to improve bone mineral density over time and may be very effective in certain populations. 1 to 3% increase in postmenopausal women over 2 years. Again, be understanding of the type of exercise which is most beneficial. Again, that's the compressive exercise, especially compressing throughout the total body. So you think things such as like overhead press, squats, standing calf raises, anything where you have that compression. Again, overhead press while standing would be, optimal for bone mineral density, those type of things. Now, again, you've got to take age and ability into consideration of, what you do and how much of that you do as well. But and physical, physical abilities, and if they've got if they've got joint problems and so on and so forth. But again, just keep in mind when trying to prescribe for trying to help the bones out a bit. Resistance training older adults increases strength, lean mass, and scores on functional independence measures. Again, I'm one of those as I get older. I really don't want people taking care of me. So, continuing to exercise and be physically functional is important. A result is an improvement in movement control, walking speed. Again, I don't really want to have falls and break my hips and stuff too. So, benefits of participation resistance training by older individuals also extend to mental health. These include improved self-esteem, cognitive ability, and reduce fatigue, anxiety, and depression. Combined resistance anaerobic training can improve self-concept, mood, positive engagement, revitalization, tranquility, decrease depression, fatigue, and tension. There's a movement, I think it's through ACSM. It's called Exercise as Medicine, and it truly is. I mean, it fights off so many, physical diseases as well as mental disease and psychological and so on and so forth. So, again, I'm not saying that like if you're depressed, exercise and all of a sudden that's gone. Just it could. It's a possibility. You still should go see a doctor about everything, but you may find that exercise may either help lessen the depression, or it may, you may be on depressive medicines, or I guess antidepressants. And with increase in exercise and things like that, there may be a time where your doctor's like, I don't know that you need this anymore. I mean, it's possibility. Again, us as exercise professionals, we don't tell you what you should take and not take, and that's up to your doctor. But those things do happen. Okay, just keep in your mind. Recommendations are found on table 12.1. Older adults should engage in resistance training on 2 or 3 non-consecutive days a week. Again, we want them coming back. We need to give them a bit more time because their body doesn't repair. Remember how quickly kids recover? We're on the far end of that spectrum now, aren't we? They need more recovery time. And again, the more fit they get and things like that, they may not have to do non-consecutive, but again, it's individualized, right? One set is adequate and is a good starting point for population. Again, you think about folks that have never worked out before and have become really sedentary, but multiple sets may yield better results. Again, start them where they are. No need to get there quick, right? Older adults without prior experience in resistance exercise may begin training with 10 to 15 reps at 40-60% of 1 rep max and progress to 8 to 12 at 70-80% of the 1 rep max. Again, you're going to not do 1 rep maxing with this population, but you'll do like a 10 rep max or something like that to project what the 1 rep max is. Again, not accurate, but it's useful. Speed of movement should be controlled. I don't think grandma or grandpa really cares what their own 1 rep max is. I don't know, maybe, but more than likely not. Again, control speed of movement. We don't want them tearing something or injuring themselves. Strength training should precede power training. In this population, power is not really, unless they have things in their daily life that require power, it's not really a necessary. Again, even in general population, I'm really careful with the type of power training I'm doing if they're not doing athletic type things, just because there's a risk reward which comes with certain power training. So always kind of weigh those out. Those participating in power training exercises involve mixing balls are ideal for reducing joint stress while training for high speed movements. Man, and I'm out of coffee. Dang. Still kind of tired. All exercises should use full range of motion. Valsalva maneuvers should be avoided because it can impede venous return, produce dizziness, blackouts, heart ischemia. So again, squats and things like, so here's the thing with doing things like squats is a big one. Most people Valsalva maneuver. And there's some other ones, bench press and stuff like that. Doesn't mean you can't do those, but you're going to have to start them off really light and you're going to have to teach them to breathe through the movements and not to, because again, the Valsalva maneuver is one of those things, especially if you've done it in the past. Some people it just comes natural to do, some people it doesn't. And again, that's the thing is, or trained individuals, it starts to become natural during certain lifts. So again, if you have an older adult that used to train, and you just got to retrain them to breathe through their lifts, and you're not going to get them heavy enough where you don't want them to naturally fall into that Valsalva maneuver move. All right. And so there's different thoughts on that, where, you just put people on machines and stay away from those lifts. Or, if those are lifts you feel are going to be important for their overall health, you've just got to get them trained doing those without using those maneuvers with no weight, then start slowly adding weight and just keeping them below a threshold where you believe they may try to Valsalva maneuver. Again, aerobic exercises are in 12.2. Older individuals can exercise 5 or more days per week, accumulating 150, 300 minutes of moderate intense, or 75 to 150 of vigorous. Moderate exercises should elicit RP of 5 to 6 on a 10-point scale, and vigorous of 7 to 8. Again, you see they switch to the 10-point for older. And again, it's part, I honestly think we should just switch it for all, because that they're assuming that younger folks somehow can understand the 12 to 20-point scale somehow better, which I honestly, everybody I've ever worked with that is not in our field tends to get a bit confused with that one, or you can tell they struggle more with like really pinpointing where they're at. Again, I think RP is hard for a lot of people just in general. It doesn't matter which one you use, because it's hard for them to really understand like where they feel that they're at. Exercise mode should be large muscle rhythmic weight bearing activities. Motivating older adults to exercise can be challenging, and studies show that less than 5% of adults over 50 years old regularly engage in moderate intense exercise. This goes back to the whole, what's more important to people, looks and health. And we have some great discussions in class over this. And this is why, I think, like when you really, I know the noble answer is like, oh, people work out for their health. The only people that truly really work out for their health at a younger age are those that have been like gone through health scares. Or sometimes athletes, and again, athletes usually think more performance. It's usually performance, then possibly health, then possibly appearance, or, those last two may flip flop. But again, this is why, I mean, most people, it's, I mean, we're very, we're very like fit oriented and looking fit rather than actually being healthy and fit. And so when you get to a certain age group, they're like, nah, I don't, no matter how fit I get, I'm still old. I am not going to look like I did in my 20s. The motivation's not necessarily is there, and so you got to start really digging into, you know, intrinsic motivations that they may have for them to be healthy, whether that's just, quality of life, like talk to them about all the things they could lose if they don't exercise, the shortness of the time that they may have on this planet, the decreased the decreased joy that they may have with other people, not being able to enjoy certain things, not being able to play with the grandkids, whatever it is, those are the things that you got to try to get into them. Again, they may have concerns about stressing their joints, injuring muscles, or causing a heart problem. Again, there's no 100% guarantee none of that will happen, but at the same time, if you're a good professional, you'll minimize the risks, right? So again, tell them the benefits, one, outweigh the risks, and then again, create training programs that minimize those risks and make sure that you're on top of not letting them do things incorrectly. Again, how do you instruct older adults? Just, part of that's going to be based on where's their cognitive function at that time, their visual acuities, their experience. Again, it's a lot of the same things like when you have individuals, some individuals have learning deficits or whatever else. And so typical cues and things that you may use may not work, right? And so you've just got to, it's got to be like, okay, I want you to do this, this, and this. Do you kind of understand that, and, so watch me do it, just, again, it's the same thing you should do with anybody, is just explain as best you can before you get them doing it. Again, with younger, healthier populations, you can get away with like them making some, like more egregious errors, so to speak, without possibility of injury. With this population, you've got to minimize the errors in movements, even as they do it the first time. Okay. So again, be concise, give good concise demonstration as well. Again, they say older adults tend to be visual learners. To be honest, all learners, I know some people are like, oh, I'm more of a visual. Everybody's a visual learner. And again, you don't just show it, you show it and you speak it out, and you give, like if there's helpful cues and things like that, like when I want people to stay back on a squat, my favorite cue to tell them is, how do you sit in a chair? You lean, but you go back to sit in a chair. I've never seen anybody bend forward and their knees move forward to sit back in a chair. Right. And so I try to get them thinking of that. Sometimes I have them sit up and down in a chair. And then we start, having them go from the chair position, and I'm like, okay, now I want you to squat up. Now I want you to slowly lower, that works well for me because that was a good visual representation for me, is a good, where you could really feel your body in that motion. And again, it doesn't work for everybody. So again, if it doesn't, switch strategies. Actively observe the older adult perform the new exercise, enhance confidence, enables the exercise professional to immediately detect, correct any errors in training techniques. Again, if they're doing something good, let them know. If they're making slight errors, don't wait for them to like fully fail on something, just kind of stop them where they're like, oh, okay, hold on, let's go back up. All right, right there, you're about to do this, and that could cause you issues, right? So make sure, be aware of this, okay? Or you can catch them or whatever you need to do. Guiding an older adult through proper movement pattern may be particularly useful when training with elastic bands and free weights. Again, you're gonna, with this population, hands-on may be more necessary sometimes than with some of the younger populations. Again, I think when you look at the spectrum of age, younger populations you're gonna be very hands-on with moving them. Older population, you're gonna be very hands-on. The middle group, it just depends on the person. Some folks, you may hardly ever have to like actually move their leg or arm or whatever. Some folks in the middle population, you're still gonna be doing that, okay? Older adults typically master exercise performance more efficiently when instructors present the key exercise components one at a time. Again, you really should kind of do that with all people. It seems a bit easier sometimes. Gradual progression, again, same as anybody, they won't progress fast. So, is what it is. Again, you'll have some younger folks that don't progress fast, right? So begin with a few basic exercises, systematically add new ones. Now here's the thing, you've got to understand, little kids and young adults are used to picking up lots of new things all the time. They're constantly being inundated and overwhelmed with things like technology and everything else, so they can learn they can take on a lot. So you could give them a lot more homework of exercises to try in the gym. Older adults, any of you that have ever worked with your grandparents or maybe even your parents on like running computers and stuff, sometimes know the frustration involved because, again, if they get a new computer, say they've never worked a computer, or or they now have switched from like a PC to a Mac or vice versa. um, they basically have this whole new thing with all kinds of different, like buttons on the keyboards to the icons to everything else that they have no idea what anything does, and they're just like, I just need this thing to get to my email or whatever it is, right? They got a one-track mind. I just need to turn this on and get there, and that's it. Right. And again, the problem is if they kind of don't learn the overall system, sometimes with computers, sometimes something may get moved as it updates, right? And so again, you want them to understand as much as possible. But what you're going to do with them on a computer is you're going to teach them just a few little basic things just to get where they want to go at that point. It's going to be the same thing. Again, you got to understand they've spent years of not doing this stuff, right? And if they ever have been in a gym, who knows what they used to do back then, or whatever. And again, the funny thing is if we always want to try to get them to the free weights, that may be what they were used to years and years ago, but they walk in the gym, they see all these crazy machines now, and that their eyes are just like, what is that? How does that work? And so you may get them past that and take them to a more simplistic area. Or again, sometimes you want them on the machines because their movement patterns aren't so great. So just teach them a few basic machines or a few basic body weight exercises or a few basic, lightweight exercises. And that's their homework for a while until they can master those and show that they can do them, and then you move on from there, right? Again, they experience some degree of uncertainty about performing resistance training. Regular encouragement can make a difference. Again, sometimes they're worried they're going to get hurt, or they've had bad experiences in the past. Or, maybe the reason they hadn't worked out in so many years. And so again, you just got to show them that you're a good trainer, that you're going to help them do it in a healthy and safe manner. Combination of positive reinforcement and specific feedback has value from both motivation and educational perspective. This is same with everybody. Older adults may not voluntarily provide information about how they feel when engaging in resistance training. Again, generational wise, I've noticed with my grandparents, like my grandpa could have been having a heart attack, and he's not going to sit there and tell his grandson like his chest hurts. Just not going to do it. He was an old World War II vet. My dad, on the other hand, from different generation, baby boomer generation, again, he's kind of an old tough guy. He may or may not, his generation there, he may be a bit more open, like, man, I ain't feeling so good. Can you take me to the doctor? Um, my generation, I guess, I think my generation is the next one down, the Generation X. Um, a lot more vocal about things, like they'll let you know, like, hey, how's this feel, man? That hurts. That's again, you know, as we get younger and younger, I think the younger generations are a little bit more open about everything. um uh, Sometimes too open about everything, just throwing it out there, don't need to know everything. you know um Man, I get some, whether it's students or just like, it's one thing when my kids are telling me stuff, but like when I meet random kids or I'm working something and they proceed to tell me everything about their entire life, I'm like, oh, okay. Or students that are telling me a bit too much about their personal lives, I'm like, I don't think I needed to know all of that, right? Pre and post exercise dialogue. Older adults generally appreciate brief dialogue with their instructor before beginning and after completing their exercise session. They're basically saying older people like to gab. And this is this is sort of a generality, I guess, or a stereotype, possibly. But you gotta think too. In that generation, there's a good chance some of them have lost a lot of friends, or maybe they've lost their spouse. They may have less physical contact with folks, and less conversational contact with folks than they used to, and so they, in those particular individuals, yes, they're going to want to talk. Okay. Some of them no. You may get the grumpy old man that's like, like, oh, so how's your day? It's fine. That's probably going to be me when I'm older. So I can make fun of that because I guarantee that's going to be me. I know I sit here and talk a lot because I'm a professor. This is actually, I'm an introvert that can talk because it's necessary. But I'm much preferred to not talk. Therefore, when I'm older and I don't have to, I probably won't. um, so that's if you ever see me, 30 years from now, yeah, that's how I'll be. Entry conversation may emphasize encouragement for attaining the workout objectives. Exit conversation may feature reinforcement of their exercise performance, right? Again, this is a great thing to do with kids as well. Like get them psyched for what they're about to do, and then afterwards, like really praise them for what they did great. Kind of reiterate like, hey, in a word, same thing with sports. It's like, man, you're hitting the baseball great today. Just remember that curveball, right? When you see it come out of their hand like that, the ball's going to move across like this. So what were the cues we went over? So that you don't miss. Okay, so you can talk a little bit about the negative, but it's always like more encouragement, more encouragement. How did they, work through those things, right? That's it. We've got one more chapter, and then you guys will basically just have your final and everything. So if you have any questions, let me know, and I'll see you in the next chapter.